don't realize how much your lips do.
Yes.
You have absolutely no idea. You just think it's your teeth.
I feel like that after I have Novocaine at the dentist.
That's that's exactly what this feeling was like. You're biting, but your lips actually pull the food into your mouth. And I couldn't pull that way. I could just bite.
We just heard Tiffany Chen, a martial artist and partner of Robert De Niro, discussing her ongoing struggle with Bell's palsy. Now, it started after their daughter was born back in April. Bell's palsy is a rare condition affecting about 40,000 people in this country every year, but pregnant women appear to be at 3 times greater risk for Bell's, especially in their 3rd trimester or right after giving birth, which is what happened to Tiffany. The cause is unknown. With us now is Dr. Babak Azizzadeh. He's founder and director of the Facial Paralysis Institute and joins us at the table. Thank you so much, because I know this is your specialty. You got on a red eye from California and came here this morning.
Thank you.
Thank you. For Tiffany, this was a complete surprise to her that this could happen after pregnancy. But it's more common than most people know, isn't it? I applaud her for speaking out.
Yeah, it happens all the time. And patients, because they recover most of the time, not all the time, they're treated and they go on, but it's a devastating process until the recovery takes place, and not everyone recovers.
Not everyone recovers?
No,
because she told us that she's been told that she has another 2 to 3 months.
Yeah, about 80% of people go back to exact normal smile function activities, but about 20% of individuals will develop something called synkinesis, where their facial movements are disorganized. They get narrowing of the eyes, they get dysfunction of the smile. Not exactly like how it was at the beginning, but long-term problems.
Wow. And how is it treated? How do you go about trying to fix the issue?
So initially, it's critical to get treatment right away. Steroids have been shown to really reduce the risk of long-term problems.
The minute you feel or see something, you're saying?
The minute you see your face kind of not moving correctly, you got to go to the emergency room.
Really?
Or urgent care.
So right away?
Right away. Because studies have shown that very early treatment reduces the long-term problems.
But doctors told her that she probably had fluid buildup, so no one thought you better do something about this. She said the thing that was life-changing for her was acupuncture. The minute she had her first acupuncture session, she noticed a difference immediately. Do doctors not know? She's told fluid buildup.
Yeah, not many doctors are actually experts in Bell's palsy, number one. And number two, she had a unique situation. Both sides of her face was paralyzed. So as a result, doctors couldn't see a lot of difference between the two sides. So it was very, very difficult to diagnose her. And as a result, she got delayed treatment until she got her MRI and so forth.
Gayle mentioned acupuncture, and of course, there's treatment if you're seen by a doctor. Is there anything else you might recommend?
Acupuncture, actually, without electrical stimulation, is fantastic. There aren't a lot of Western studies looking at it, but it's been used for millennia. Long term, if patients do not get recovery, we've pioneered surgeries and treatments with Botox, physiotherapy, and surgeries that can actually help patients really recover well.
Do you find most women don't talk about this, that they're suffering in silence with it?
Huge, because it's embarrassing, right? And people they stop smiling and they get depressed because smiling really releases endorphins and makes us happy. And when you stop smiling, you go down and go into major psychosocial issues.
Wow. Dr. Babak Azizzadeh, thank you so much for joining us.
Thank
Are
you
you
very
flying
much
right back to Los Angeles?
No, I have one day in New York.
Okay.
I can't come
Enjoy
here.
yourself.
I can't come here and leave right away.